Hello, I'm Akili and I'm a graduate counselor, and today I'm going to be talking about counseling considerations for children with autism spectrum disorder. Okay, so to begin with a little bit of background information, what is autism spectrum disorder? So it is also referred to as ASD and simply just as autism. And throughout this presentation, I'm just going to be referring to it as autism, but they are all interchangeable. So, pretty much autism is described as a neurodevelopmental disorder marked with impairments in social communication and the presence of restricted or repetitive behaviors. And autism is often accompanied by co occurring conditions such as anxiety, depression, ADHD, or sensory or medical challenges. And according to the CDC, 1 in every 110 children are diagnosed with autism. And I have 4 years of experience working with children diagnosed with autism. I absolutely love children. So, from my time working with this population, I gained a lot of knowledge, like of what's effective on how to work with them and what isn't so effective. So, throughout this presentation, I am going to be using my first-hand clinical experiences as well as research and literature. Okay, so I just want to specify what population I'm specifically talking about, because just saying children diagnosed with autism is very broad. So, for this presentation specifically, I am referring to children from the ages of 4 to 18 who are diagnosed with autism. However, you can get diagnosed with autism at any age. And then I would just move my picture so that you can, actually I'll move it back up here. But yeah, so autism is a spectrum, meaning that people can present with a wide range of abilities, strengths, and different needs. So I want to just specify what level I'm specifically talking about. So the DSM kind of categorizes autism in 3 different levels. So I am specifically for this presentation just talking about levels 1 and 2 autism. And I pulled this chart from the DSM-5 TR where it kind of breaks down the different levels. So starting with the bottom is level 1, and level 1 is referred to as requiring support. So individuals with level 1 autism tend to struggle with social communication without support. They have difficulty initiating or maintaining social interactions, and they have behaviors that interfere with their functioning, and they have challenges with things like transitions and organization and planning. And then moving up the chart, we have level 2 autism, which is also referred to as requiring substantial support, and it is characterized by marked deficits in verbal and nonverbal communication. Even when there is support, limited initiation of social interactions, behaviors that are noticeable and disruptive, and significant distress when there is a change of routine. And then at the top of the chart, we have level 3 autism, which is referred to as requiring very substantial support. So with this level, individuals tend to have severe impairments in social communication. They have minimal social initiation or response, and they have extreme difficulty coping with change. So again, just for the sake of this presentation, I am just focusing on levels 1 and 2. And levels 1 and 2 are sometimes referred to as higher functioning autism, and then level 3 is sometimes referred to as low functioning autism. But just because I'm only focusing on levels 1 and 2, that doesn't mean that people with level 3 autism can't receive mental health treatment. But they definitely can. They would just likely need a different type of treatment. But again, so just to reiterate, this presentation is specifically focusing on ages 4 through 8 with levels 1 and 2 autism. All right, so now that we kind of specified the population, the first consideration that counselors should take into account is the client's culture. So, culture is very important to take in mind. So, culture, this includes beliefs, values, language, rituals, traditions, and other behaviors that are passed down from one generation to another. And culture really affects all of treatment. It affects the diagnosis, the treatment planning, the interventions that are used, just everything. So culture can also affect when someone is diagnosed with autism. So, for instance, children from ethnic minority backgrounds tend to be diagnosed with autism later than the majority population, so white children, and they are also less likely to receive early intervention services. However, this does not mean that minority populations don't have autism. It just is less accounted for due to systematic barriers such as healthcare, language differences, lack of culturally responsive providers, socioeconomic status, a history of mistrust with the system, just kind of a lot of things go into why this is. But cultural factors also shape how families understand child development, behavior, disability, mental health, how a diagnosis is perceived, and how a family will pursue treatment for their child. So, for instance, some families, they believe that behaviors associated with autism are just kind of more personality traits such as shyness or like developmental delays rather than being signs of a condition such as autism. And then in other families, they might kind of interpret autism as being like a spiritual or like religious belief. So they might think that like their child is uniquely gifted, or they might believe that their child is different for spiritual purposes. And then in some cultures, having a disability is very stigmatized, which leads some families to avoid seeking help out of a fear of judgment or blame or social exclusion. And then different cultures also have different views on treatment. So some families might prefer to rely on extended families, elders, religious leaders, and then other families might prioritize like medical or behavioral interventions. And then different cultures also have different beliefs for what causes autism. So, for example, some people believe that it's genetic, some people believe that it's caused by environmental factors, and some people believe that it's caused by vaccines. So whatever people believe, it's really important for counselors to always be respectful of these differences and to allow the client to have their own opinion and to really try to avoid any countertransference. So an example of this is a family, they might delay getting like an autism evaluation because they believe that their child will grow out of it. And then a counselor might kind of view this as them being like resistant or defiant or in denial about their child's autism. When in reality, like there's so many different cultural contexts that this could be. So you really have to view it from the lens of their culture. So this might be a reflection of a fear of getting stigmatized or just negative experiences that they might have had in the past with the system. It could really be anything. So counselors really have to watch out for that. And then this example also really shows why cultural humility is so important. Counselors really have to recognize that they are not the expert and the family is the expert of their own culture. So it's important to stay open minded, curious, and respectful. And it's okay to ask questions. And if you do ask questions, then just ask open ended questions, such as like how the family understands their child's behavior, what autism means to them, and what their goals are for treatment. So asking questions, it can be helpful for allowing the family to kind of define their own values and priorities rather than feeling pressured to conform to a single model of care. And then it's also really important for counselors to self reflect on their selves and their own biases and make sure that they are not bringing any of that into treatment. Because at the end of the day, we really all have the same goal for the child, which is that they're thriving and that they're successful and happy. So it's really important that we're respecting everyone's opinions. Okay, and then I will move my picture down. The next consideration is coordinating the client's care. So coordinated care is really important in promoting the client's overall functioning and well-being across different environments. And what I mean by coordinating the care is ongoing collaboration and communication with all individuals and systems involved in the client's treatment. So that could include like school professionals, medical providers, therapists, counselors. An effective coordination involves sharing relevant information with appropriate consent, of course, and aligning treatment goals across different settings, addressing any barriers of care, ensuring consistency in interventions and expectations. And another really important aspect of coordinating care is to be an advocate. Counselors really need to advocate for their clients, especially with children with autism, because children with disabilities often tend to go unheard. Systems, a lot of the times, they don't really like to listen to people with autism, and so it's kind of helpful for counselors to kind of help give a voice to people who are unheard. So advocacy can happen on different levels, such as micro levels, which occurs on a more smaller scale, and then also a macro level, which is a more larger scale. And in a paper that I found by Ennis, Cole, and colleagues, it talks about how advocacy takes place on 3 different domains. So the first domain is the student level. So what this kind of looks like is a counselor maybe helping to make sure that a client has access to like essential resources and maybe like referring the client to different services. And then the second domain is the school and community level. So that kind of looks like advocating for maybe like supporting families in understanding their educational rights and responsibilities and helping them understand different laws. And then also, if a client, if their school isn't following their IOP, then a counselor might step in and advocate for that client that their IOP is being followed, because that is a law that schools have to implement and follow an IOP for children with disabilities. And then the third domain is the public domain. So that might kind of look like a counselor maybe trying to get business leaders and community members to create opportunities for children with autism to help them develop skills, contribute, and be, valued members in the community. Okay, so something else that is important for counselors to consider when working with children with autism is to include and work with their parents and their families. So this doesn't just mean disclosing anything that the child has shared during the sessions, because of course clients have a right to privacy and confidentiality. So as counselors, we have to make sure that we're respecting those rights. But instead, what this looks like is holding occasional meetings with parents to kind of help them understand their child's diagnosis, help them develop realistic expectations, helping to guide them in being involved in their child's treatment, because parents do really play like a really critical role in supporting their children's development. Um, this might also look like involving families, so maybe having occasional family sessions that include the parents, siblings, grandparents, really just any family member that is involved in the child's life. And these occasional family sessions are very helpful to support communication, collaboration within the family, to help the family understand the perspective of the child with autism, and to kind of help um, work out any challenges that there might be. And then it's also really important for the counselor to keep in mind that the family is also very impacted. Like a lot of the times, parents go through like grieving, like in relation to like unmet expectations, chronic stress from caregiving responsibilities, financial strain, and concerns about their child's future. And then siblings might go through also a lot of emotions themselves by feeling like they're not getting as much attention. So these occasional family meetings are very important to kind of give space and time for the client to kind of help the family work through these challenges together. Okay. And then another consideration for counselors is to be mindful of the lighting. So you want to make sure that you're creating an inclusive environment for the client. So it's really important to make different accommodations. And children with autism, it's common for them to have like a sensory sensitivity to different things such as lighting. So direct lighting can affect a child's emotional regulation, ability to focus, their overall comfort. Um, and then harsh or overstimulating lighting can really increase anxiety, distractibility, and sensory overload, while more appropriate lighting can kind of help them feel more calmer and engaged more. So, what neurodevelopmental friendly lighting typically looks like is a warmer tone that is dimmable, quiet, meaning that it doesn't like flicker. And then it should also be free of any glares and any sudden changes in brightness. And then LED lighting is usually what's pretty best suited in therapy spaces for children with autism, because it allows for adjustable brightness. And then it also minimizes sensory impact, while in contrast, fluorescent lighting has kind of been linked to headaches, visual discomfort, increased distress, sensory sensitivity. So, yeah, for children, it's really important to really make those changes. Even just something so small as lighting can really be such a powerful accommodation, and it can really increase their sense of safety and comfort. Okay. So, another consideration is for counselors to be mindful that it is important to be patient because process can be slow. So there's a study that I linked the researchers down at the bottom. But they did a study and they found that counselors reported being frustrated with doing a lot of repeating themselves and not really feeling like they're getting anywhere. And this is definitely a very valid concern. Like, it definitely can feel very frustrating, feeling like you're not really making any progress. But it is important for counselors to remember that progress with children with autism is often very gradual and non-linear. So it's really important to have patience. Some skills might need to be taught repeatedly and over again. So something that can kind of help with this is for counselors to try to measure progress in small, meaningful steps, rather than kind of looking at the whole picture all at once. And it's also important to remember that consistency and persistence is more important than the speed of treatment. All right. And then something else that is important to consider is to make counseling fun. So traditional talk therapy is probably not going to be the best way to go for this population, especially for younger children. So what I personally like to do is incorporate like a lot of games and activities. We might do drawing or arts and crafts. Something that's like movement based and that's really getting us up and active. And I found that my clients really enjoy this. And then it's also a really good way to get them engaged. It helps with emotional expression, skill acquisition, building rapport, and it also allows the client to communicate in a way that feels safe and natural to them. All right. And then another consideration for counselors is to personalize treatment. So, autism, again, it's a spectrum, so it presents differently in everyone. No two people present the same way. Even identical twins, like, they will both have two completely different presentations of autism, so it's really important to individualize treatment to fit the specific client. So, with that in mind, some things to consider are the client's cognitive level, communication style, sensory needs, and emotional regulation skills. But this list is really endless, like, it goes beyond these things. And then here's an example. So this is something that I like to use to kind of check up with clients' symptoms. And I would use this for more advanced clients who do have that like cognitive processing. And then that contrast to these where I might check in with a younger client or maybe a client who isn't as cognitively advanced. I might use pictures or the inside out kind of graph. And I found that this is a fun way to kind of engage them. And then this is also a learning opportunity to kind of help them to learn that like a mixture of two different emotions can cause another emotion. All right. For future trends in counseling with this population of children with autism, I think there definitely needs to be more training on autism. In the same study that I referenced earlier, which I put down again in the corner, the therapist said that they felt like they had limited training in autism, and then nearly all of the therapists in the survey expressed interest in additional training for autism. So I can definitely see a need for this in the future of therapists to kind of get more specialized training in autism and more hands-on interactive learning opportunities, and increased interdisciplinary collaboration. And then some of this is kind of up to the counselor to kind of take that initiative and kind of seek out those trainings and those opportunities themselves. But on a wider scale, I would like to see that just more available in general. And then these are the references I've used. So thank you so much, and I hope that was a helpful presentation.